Hello, everyone on the call. Welcome to our monthly meeting. This is the November meeting of the Health InfoNet Behavioral Health Information Technology Reimbursement Initiative. Thank you for joining us. I'm Gemma. As you know, I am the Behavioral Health Program Coordinator at Health InfoNet and the chairperson for today's call. We do have a lot we're going to be covering today, but before we get started, just a reminder of just some basic things that we do. The questions and answers will happen after the meeting is over, but you can always use the chat feature to put anything in as it comes up for you, so you don't have to hold on to it and try to remember. The meeting objectives today, I'm just running through some introductions here. Katie will give us an overview of what to expect for Sim Year 4. Thank you for participating. I will then give you a little overview of what we're looking for the quality project. I know a lot of you have questions about reports and what's going to be required, so we'll go over that today. And then we do have some wonderful guests to present today, and that is Tri-County and United Cerebral Palsy of Maine, UCP. Unfortunately, Amy Peel is not feeling well today, so we will have to wait for her January presentation. She has agreed to come on board next month, but we will be hearing from Lisa as well as from Doris Skarka and Delaney Dow. And I just want to say one thing about these two nurses. This was not planned this way, but it is how it is. These are the two highest users of Health InfoNet in our behavioral health initiative. So we have a lot to learn from them. So I'm really excited that they're here to share their stories, as well as Delaney, who we're hearing an awful lot about how the behavioral health coordinators work in the behavioral health home. So it's exciting to have you all. And then we'll have the Q&A. So hold on to your questions for the end, and now I'm just going to hand it over to Katie.
Thanks, Gemma. Good afternoon, everyone. It's a pleasure to be able to continue with our SIM initiative for another year. I can't even believe that it's been 3 so far. So I just have a couple. Okay, so just a little contract housekeeping. What we were able to do, now that our contracts are completed with the state and the Department of Health and Human Services, what we're able to do is now work with you all formally and continue the initiative work. So what I have completed here with Health InfoNet leadership is a contract amendment to the previous, what we've kind of referred to along the way as the project contract, which is between Health InfoNet and each of you who are continuing the activities of the first 3 years and now continuing to what we're referring to as year 4. And so what Gemma will be doing is emailing everyone individually the same points of contact for the participation agreement. She'll be emailing you out a very simple amended contract that builds off of the initial milestones that were agreed to. And so basically what it says is that if you hadn't completed the final go-live data milestones for the initial contract, you are able to continue that activity and thus be paid out those milestones as originally agreed to under the first contract with us. So we have that money that we are holding on to with the foresight of you being able to go live with data sharing in Sim Year 4. For those of you that have already completed those milestones, that's done and over with. But what everybody has, which is new for Sim Year 4, are new milestones. And you'll see that spelled out in terms of what those obligations are and then what the payment associated with that is, which I'll talk about on the next slide. So what you're really agreeing to, and Gemma's going to continue to talk about that, is the quality improvement work. We want to keep it going. So we want to keep notifications flowing. We want to keep your focus and attention on that group that had high ED utilization for unnecessary events and continue to improve the quality of care for those folks with appropriate utilization. And so I know you know what I'm talking about, so I won't belabor that point. And then just in general, and we've met with different folks on the call today around your plans for year 4 for those that may have been struggling in the prior year to expand access and utilization to Health InfoNet tools and services. And so we know that all of you have really positive intentions and are already actively expanding access, and we're going to hear some of that success today. The big announcement today that I think some of you may already had a heads up on is that we were able to secure an additional $5,000 of reimbursements for the SIM Year 4 milestones. And in the contract that's sending out this week, it'll say explicitly how that money is earned, and we'll be working with you to approve that as quickly as we can under SIM Year 4. The one thing before I hand back off to Gemma, I just wanted to thank everyone who has turned in their participant agreement with Health InfoNet. I've received 10 out of 20. So we still have 10 out there. And what I don't believe I have any emails still pending for folks that had legal questions or back and forth. For the folks that have had questions, we've been able to address those and move those contracts along. If someone is still feeling like they have questions and they haven't heard back from me, please send me a note and let me know that, because it most likely means that it got lost or I just didn't see it. So I apologize if so. Our hope is that everyone, all the remaining 10, get signed and implemented as soon as possible, along with the new contract documents you'll be receiving. If there's any questions about any of this, feel free to shoot me an email or put a question in chat. Happy to be as open about all of this as you guys need to move forward. So I'm going to transition back to Gemma now. She's going to talk about the SIM Year 4 goals related to quality and how we're going to be operationalizing SIM Year 4. But I just want to thank all of you so much for continuing this really critical work. We've really enjoyed it and have seen a huge difference it's making in your work and your staff's day-to-day satisfaction. And to see behavioral health homes continue to expand and succeed, it's just great synergy, it's great work, and this is really what we're all trying to do. So thanks so much, and back to you, Gemma.
Thank you, Katie. I just want to echo what Katie said. I think everyone here at Health InfoNet is just so impressed with what we're seeing from our behavioral health partners, and we're looking forward to SIM Year 4 and working with you to get some of these things just a little bit more ingrained so that we understand just a little more completely about what works and what can bring all of us to the best quality outcomes for our clients. So for SIM Year 4 expectations, we are asking for attendance at the webinars that we have scheduled below. As you can see, they are not monthly. We decided not to do them during the weeks of holidays or vacations. We know that that's hard for people to come to. So we've limited it to this number. We would like all of you to be joining us. The SIM experience for us has morphed from an IT, really a project, to a clinical, hands-on, boots-on-the-ground project, people who are doing the work and using Health InfoNet, using the clinical portal to help have higher quality outcomes for their clients. And so what we would like for these seminars, these webinars that you can see listed above, we would like you to include not just those of you who are on the call, but now to be opening it up to, someone on your staff who is in these roles that you would use Health InfoNet, the social worker, nurse care manager, health home coordinator, case manager. If you know these dates in advance, I know these people are busy, you can get it on their calendars. And we really encourage them to come. We'll talk a little bit more about that in a couple of minutes. In addition to that, instead of a monthly report, giving us a monthly report, we would like these folks not only attending the webinars, but also to be doing a follow-up phone call, one follow-up phone call with me, one individual on the call with me, so that, and I will record this, so that we can actually collect the data really more specifically about how each role uses Health InfoNet and how that plays out in terms of care. So And again, I just walked into this, but we do want to dig deeper on the interventions. And the interventions are those interventions that any of you that completed the form that we had about 2 months ago, which had the 10 interventions that are used by your staff most often when going in and using the HIN clinical portal. Those are the 10 interventions that we're talking about. And I'm not going to go into them in detail right now, but I wanted them on the slide deck for your easy access and review. It's targeted care management, hospital support, locating clients who are missing, and you can see the green buttons below each of these high points give you a little bit more detail. The comprehensive transitional care that you all do, to identify and coordinate with the client's care team, which is part of your work, conducting medication reconciliation, intervening with the client post a medical event, engaging, educating clients. These are all familiar to you, I know. Assessing the accuracy of the SMI diagnosis, identifying gaps in overuse of medical care. So these are going to be the basis, kind of the foundation of some of the work we're doing. We want to get more in the weeds about specifics. And the best way to do that is to actually talk to the people directly who are doing the work. The phone call, you are not required to be on the call. You're always welcome, of course. We're looking at about 30 minutes, again, recorded. And the purpose is to meet that goal that we have to really be able to identify what staff member does what intervention using Health InfoNet and the difference that it makes. We really want to get into the weeds on that. So we appreciate your support with that. And you might wonder, why does the clinical staff have to come to the webinars? And I will tell you, we are so proud here at Health InfoNet. We're so proud of all the work you do. And one of the things that we know that perhaps you're not aware of, but there's not the ability for your counterparts in other states to do the work that you're doing. You're breaking new ground. You are actually the new experts in this field because no one else is doing what you're doing. And I think it's very important for there to be peer learning. We all here at Health InfoNet believe strongly in that, and that your staff can learn from each other, as peer groups. But specifically on leveraging health information technology, specifically our HIE, to actually get to the results, because we've seen such stunning results from the quality project so far. So we want to keep going, and this will give us more to report, which is very exciting to us. And when I'm talking about experts helping each other and showing the way, we do have today Lisa Anderson. Amy is not able to be with us. She has agreed to join us in January, so this will be something we're looking forward to. But Lisa Anderson is here from Tri-County, and after Lisa speaks, we'll be listening to the folks from UCP. So again, this is just the beginning of some ongoing peer knowledge that can be shared for everyone to take advantage of and to improve your own work day to day. So Lisa, you're on the call. If you could do a *7 to unmute yourself and say hello.
I just did, and here I am.
Hi, Lisa. And I want everyone to know Lisa is new at Tri-County. Lisa, do you want to tell everybody a little bit about that?
Sure. I started with Tri-County at the beginning of September. I came to this organization with a background in primary care, so I had some history with Health InfoNet and really pushed to get through the training in the academy and get my access through Tri-County so I could get in and start accessing patient information.
And Lisa, you mentioned the academy. I remember you also saying that the case managers, you had them all go through the academy as well.
Most of them had done the academy, and I think there was some confusion on their part because they hadn't been able to get in and really utilize Health InfoNet after that. So I did do in one of my locations kind of a refresher course for the HHCs on how to get into Health InfoNet, how to set up notifications and load in their own clients.
So I'm interested in that kind of learning curve. If people are maybe getting an introduction to Health InfoNet, and perhaps it's a couple of days or weeks, or maybe a month as a lag between them being trained and them getting on board, you found it helpful for them to have a refresher that you yourself was able to give them?
Yes.
Okay, that might be helpful for other people to see. Okay, I'm going to just everybody on the line. These are these are Amy's slides. So this is coming attractions, we'll call it. I know that some of you on the call are new BHHs rolling out, and that was one of the reasons I thought it would be really, really cool to have Amy speak with us today, but she will come on board in January. So here we have our new nurse care manager, and Lisa, that is you. So why don't we have you talk a little bit about your experiences?
Well, what I did once I had my access through Tri-County and I looked at my client lists here, I currently am covering adults and children for 2 different locations. So I went in and I have added my client panels. I have a little bit of one panel left to add into notifications. So every morning when I come in, I get my daily email. That's how I chose to set my notifications up. I go into Health InfoNet, look at those clients that have had activity in the portal, find out what it was. And as the slide indicates, I did put in labs as a notification so I can track my diabetic clients or my clients who are on antipsychotic medications to make sure that they're getting their A1Cs done. That's one of the metrics. So that's my morning. I start through and I will document in the client's charts what I'm finding. And then I kind of touch base with our HHCs to let them know if their client was in the emergency room, if this seems to be a pattern with this client. Are they de-escalating? Is there a health issue that I need to step in and kind of do some education with myself? Just kind of keep everybody on point on what's kind of going on with the clients medically.
And I'll move you along to an experience that you had. You want to share?
I did. We had a client who was pregnant who had very spotty prenatal care. We were having a lot of difficulty getting in touch with her, keeping in touch with her. Her voicemail was not set up, so there was a lot of phone tag. Had a history of homelessness. We were very concerned about the client and the baby. And so I had set this particular client up in our notifications to kind of monitor and make sure that she was safe and getting care. And I was able to notify her case manager, her HHC, when she was admitted into the hospital in labor, so the care coordinator could go in and meet her at the hospital and make sure that appropriate referrals were made and that she had things set up and care for when they were discharged home.
I love that. I love that story. I think we hear news stories every day. That's the first one I've heard of finding a mom. So lovely use of Health InfoNet. It's not just about the technology. Really, it's about the people that it's helping. Exactly. So you've also used Health InfoNet for the medication reconciliation.
I have. We had a client. I was going to meet with one of the HHCs. She had a lot of medical conditions. I went into Health InfoNet to kind of prep myself for meeting the client, so I would have a little background on her history, knew she had had some recent medication changes, and when we were at the home, she had expressed some frustration that one of her medications had been filled incorrectly again. I questioned her. She was able to show me her medication bottles, and having had the access to Health InfoNet ahead of time, I could kind of formulate what may have happened with the pharmacy on her medications. It looked like there were a couple different doctors involved. I explained what my thoughts were to the client and offered to advocate for her with the pharmacy. And while I was present with her at the home, we called the pharmacy, reviewed our concerns. There was an error made on the pharmacy part, and they were able to correct her dosing, and she was able to get the correct medication.
So it really points out the importance of looking at the medication list. I know that not everyone does that, but how important that can be because mistakes are often made.
And I think that's when you have multiple providers involved, and at times some clients use multiple pharmacies, it's very easy to happen. I also look at the medications because if they are seeing somebody for medication management who also has a PCP, the PCP may not be aware of everything that the med manager is providing, and there could be interactions between the medications provided.
Interesting. So it's something that people are more at risk of today than they were perhaps a few years ago.
I think absolutely.
There's more cooks in the kitchen, so to speak.
Yes.
Has there been a difference for you using Health InfoNet in the primary care setting and using Health InfoNet in the behavioral health setting?
I think a lot of the information that I'm looking for is similar, and that may just be because my background is primary care, so I'm kind of aware of these things to look at. What I do with the information and who I'm relaying the information to is a little bit different, and I think it's been an education between myself and my knowledge and the HHCs on why do I care about this piece of information I'm giving you? How is this impacting your client? And you may want to have this discussion with them, or I can call them and have this discussion.
And so it's a little bit of an education from you to them. Are they sometimes surprised to hear your concerns about a medical issue and how it plays out in somebody's life?
I think there have been some eye-opening. I think anybody in the behavioral health field knows that your mental health impacts your physical health impacts your mental health. It's breaking down the barriers in between the two silos, as Amy would have discussed, to make that communication there. And I think that that's where my role is coming into play in giving the HHCs the knowledge to then go with the clients and advocate with their medical providers, and just giving them, I guess, the tools to use when they're there.
So you're not only empowering the client, but through education and information, you're empowering the HHCs as well.
Yes, the whole team.
The whole team. That's wonderful. Thank you so much. We've really enjoyed seeing Tri-County just move up the scales because I think when you do become a health home, it does change the way that you do your work. And I know that's something Amy will talk about more when she's back in January. So thanks for joining us. We also have with us Delaney Dow from UCP and Doris Skarka. And if you both could do a *7 and unmute yourselves. I want to tell everyone on the line if we hear any background noise, they do have a play group that's upstairs. Is that right, Doris? Is it a play group?
Yes, we do. But, it might add a little bit of pizzazz to the presentation, too, and a little nice background noise. So. But right now it seems to be quiet.
Well, we're all fine with the kids, so that's fine. So I'm going to just hand this over to you, Doris, and to Delaney. You have a lot to tell us about how UCP has been using the health home model and kind of taking off.
Thanks, Gemma. I'm here with Delaney Dow, and she is a health home coordinator, as Gemma has told you, and we want to share with you how we utilize HIN in both our individual roles and then basically how we as a team communicate and using HIN within that communication and within our behavioral health home. Our UCP, in my role at UCP as nurse care manager, I absolutely use Health InfoNet all the time. I use it to monitor and follow our high utilizer clients. I set up notifications similar to what Lisa was describing earlier, and I wanted to monitor and follow those high utilizers. And I also do that based on other patient needs too. I don't just focus on the high utilizers, but because of using the main care portal, I can see who the high utilizers are, and I do focus in on them a little bit in the morning. I also have monthly meetings with, or I do, our team has monthly meetings with a PCP office that has 50% or so of our clients, so that we can discuss any concerns that we have regarding high utilizer clients. And Health InfoNet really plays a role in that, because I go in and do the latest research and to see where that client is and what points need to be discussed so that we can help that client. I also look at specialists or consultants' reports for our clients. We have children who have acute health care needs, and that they affect multiple systems, so that I definitely will look at the nephrology report or the cardiac report, et cetera, to see where the child is. Number one, did they really go to the appointment so that they could be evaluated properly? And then what are the results from that appointment? So that what we're hoping to prevent are future problems or future visits to the ED or hospitalization. What I also do is track and follow up, as we all do, I'm sure, ED visits and behavioral health home quality monitors. We, as a behavioral health home, have the main value-based purchasing management system, and in there we have our quality monitors, and we have to look at all those, like PCP visits, number of hospitalizations, ED visits, antipsychotic meds. We all know that we're looking at that right now in relation to hemoglobin A1Cs with children on atypical antipsychotics. So that is essentially what I do in my nurse care manager role and using HEN. And I'd also like Delaney to talk a little bit about how she uses Health InfoNet too.
As a coordinator, I use Health InfoNet to complete my comprehensive assessments. So I do this annually, as well as for intakes for my kiddos. So what this consists of is using Health InfoNet to view specialist visits, office visits, ERs, and walk-ins in order to complete that paperwork, to really get a gist of, the kiddo's mental health needs as well as their physical medical needs. I also stay informed with the kiddo's medical as well as mental health needs. So this will consist of, sometimes if it's requested by the parent, I will attend well-child check visits. And this all depends upon the level of the family. If it's a parent who doesn't quite understand the medical field, I can step into those visits and really ask the PCP some of the questions that the mother and I or the father and I have discussed. Also, I attend monthly meetings one-on-one with the parent or the parents, as well as if the client is usually in the teenage years, I can have a sit-down meeting with them to really discuss their medical needs or mental health needs that are taking place. Because sometimes the parents, they don't get out all that information at the doctor's office, so I'm there to, advocate for the client's needs. And then another angle I go at it is if it's requested by the parent, I will attend the medication management meetings. And this also gives me another perspective into the client's mental health or medical needs. So I'm really getting 3 different perspectives, and then I carry that information over and I report it to Doris. And then we can sit down and view that information, or Doris also has that information in order to continue on and really understand the family and what's going on. And if I do not attend the well-child checks, if I don't attend the medication management meetings, I will use Health InfoNet. there are providers that are out there that I can view the medication management notes, and usually it's for developmental needs. So I'll view those, follow up with the family after that, and really see if all their needs are being met at this time.
Well, that's a lot, Delaney. Thank you. Thank you. Doris, I know that both of you work so closely together and that you have a workflow in place. Can you tell us a little bit about the workflow that you do?
We do. I think I talked a little bit about this earlier as far as what I do when I first come in. I look for my notification and alerts and make sure that if there are any, to follow up with the appropriate healthcare coordinators so that they're aware and we can discuss what's going on. And then also I look at all the medication issues that are affecting our clients depending on if they're on antipsychotics and are the appropriate lab works being done, those kinds of things. And then if I find anything when I'm looking through all this, the biggest thing that we do is we frequently meet to talk about the clients. We decide when we sit down and meet, we discuss clients, and we decide who really needs to have some targeted follow-up. We frequently see each other daily. Our setup is really nice because we're all together in similar office space so that we can easily meet with one another, and any health home coordinator comes in and says, listen, I've got this client and these are the issues, and if it's something that I need to be able to describe to them medically, or quite frankly, they're helpful for me to understand family dynamics and the background of everything that's happening within that family and environment. So there's that exchange going on. And we frequently, we have 3 team meetings a month where we discuss clients as our team, and we also have our peer support specialists within that team meeting too. So we really get some good information from the whole team, and we're able to discuss clients there. And we frequently send emails. I may find something in HIN, or a health home coordinator might have stumbled over something and sends the information to me. So I think the key to why it works so well for us is we all communicate all the time. It's not that we have to wait for a specific meeting, we have to wait for a specific time. We're both using HIN, all of us are using HIN, I should say, so that if depending on who sees what they think might be an issue, we definitely communicate that to the appropriate person. When I first started out, I did meet at like every 2 months and or 3 months and sit down and do a comprehensive list. I found that doesn't work that well. What I try to do now is every 2 months to update my list, because again, in our behavioral health home too, we may discharge some clients, some new clients may come in also. So that helps me keep track of what's going on within our behavioral health home. And I think also the slide that, you're up to key lessons learned. Sorry, I'll get right to there. Initially, as I said, we had monthly meetings to address medical needs, but they truly weren't beneficial. So we decided, or to tell you the truth, it just kind of grew out of, because we've been in this now, it's almost 3 years, that it just didn't work. It was too static. We needed something more dynamic, and because things are always changing. So again, we have the active communication that goes on a daily basis. Real-time communication to be proactive. When we first started out as a behavioral health home, we really did not have that real-time information, and it was a problem. It was hard to get information about ED visits and hospitalizations, or even regular PCP well child visits. So the real-time communication, again, goes along with being proactive and also being able to communicate on a daily basis and get things done more efficiently. And with the timely intervention, some of our children, as I explained before, do have some acute medical needs. And let's say they need oxygen, they're immunocompromised. They need to make sure, or we need to make sure, to help the client and family to make all their visits with their specialist and their PCP, so that they don't develop even just a common cold, which can really develop into something that can escalate to either illness or in the ED or hospitalization. Because the trauma of hospitalization for the children is very real, and also for the families. The families may not have the transportation to visit children, or they have other children at home that they have to take care of. And then some of our clients, our children, are autistic, so they can't communicate as well. It's a strange environment. It's very frightening. And so what we try to do is to make sure that we utilize all the information from Health InfoNet to prevent that from happening. We also do that with, I know that we highlighted medical issues, but we definitely do that with mental health problems or concerns from our families, and we'll be talking about a case study at the end of this just to highlight that for you. So, life before Health InfoNet, the wasted time. I like this slide because in truth it was wasted. If I needed to have any kind of information, whether again was lab results, radiology, well child checks, I really had to spend an inordinate amount of time, phone calls, faxes, and again, I always felt like I was playing catch up because it was old data. It wasn't current, it wasn't real-time data. So waiting for information, it could have taken 1 to 2 weeks to get that, and by that time, it's really old data. So I am definitely a proponent of HEN. I absolutely love it. I use it all the time in our behavioral health home. And so do our health home coordinators. They definitely love it. Do you want to speak to that, Delaney, a little bit? Or?
Yeah, I can speak to that. Usually every month, at the start of the month, I will go in and review all of my BHH clients. Sometimes, I find new information and I'll review that information, or I'll shoot Doris an email to say, hey, I'm not quite sure if you noticed this, but, I kind of have a question on this, and then we'll follow up. But sometimes there's no new information, and that's always helpful because I know that, they haven't been in the office or they haven't been in the ER. And so then it's just, really following up with just the one-on-one meetings. But it is a nice resource for me to monitor their medical needs as well.
And we also, Delaney and I have talked about this, we really like the patient summary piece of Health InfoNet. It really gives you an idea of when appointments are scheduled, whether they're future appointments or appointments that have been already met and completed. Because if I'm looking, let's say, for a well child visit, it's a lot easier to look over that patient summary to see when the well child visit was done or at least scheduled. Sometimes it's there, but it's not really done because they had to reschedule. But it gives me a time frame, so I have to look through all of the well child visits either to get that kind of information. So it really saves me a lot of time, and I'm sure it saves the health home coordinators a lot of time. I also like the medication section as far as giving us the most current meds that are being filled. Not necessarily taken. We have to make sure if they're taken or not, but at least it does give us an indication of what has been ordered and what has been filled. Delaney, again, I could have you talk a little bit about the health home coordinators using that patient assessment so that it gives you some information to talk to clients.
And with that patient summary and reviewing the medication section of HIN, I'll review that, and Doris and I will follow up. And if something's not looking right, I can jot some notes down, and then I'll go to a one-on-one meeting with the family and really figure out what's going on. Did they have extras? A couple days worth? Are they just not taking it every day like it's ordered? Just along that line. So then when I attend a medication management meeting with the client and the parent, and they ask the same questions, we can really see if there's a disconnect or not and figure out where that disconnect is, so I can work with the family on making sure, the meds are taken as they've been prescribed.
I also want to say that the health home coordinators really are the heart of this program, and they do a fantastic job. They really develop trust with the families, and that is so key in that developing that relationship if you want to help clients in making any type of change, whether it's in the medical realm or in the mental health realm. It's the family dynamics and environmental issues make a big difference in how things are going to, how outcomes are going to be met. I just wanted to say that particularly here, we really work well together. I have learned a lot about just building a relationship with clients and how that trust has to be there. They have a protective nature about what they want to talk to people about, and they have a right to be because it's their life, their home, etc. So you really do have to build a good relationship, a trust relationship, before you can decide or help them decide to make any changes. And I also learned a lot of terminology because my medical background didn't have all the HCTs and all the other abbreviations that I was used to. So I learned a lot from them. What we wanted to talk a little bit about, too, is we had a client, and we just wanted to outline a case study in relation to how we utilized HIN. We don't want to get into a lot of the details of the client in the study, but we'll give you an overview. We had a teenager. She had, or the client had major depressive disorder. This client had 10 ED visits within an 11-month period of time, 6 mental health inpatient stays, and 1 partial mental health program stay. So Delaney and I met, and we decided what we were going to do is look in Health InfoNet and develop a timeline of all the ED visits and look at the notes from those ED visits to see how many occurrences there were, what time of day, what part of the week, what precipitated each visit. Was there a precipitating factor? And then did a pattern develop? And we did see a pattern that developed ED visit-wise about 4 to 6 weeks apart. And then we thought, well, were there any repeating cause or triggers, or were there multiple issues? And I think in this case, we did have some repeating triggers, but there were also other issues that caused some admissions also to the ED or to the mental health facility. So what we did is we tracked all that through Health InfoNet, and we monitored the labs, and also in this case we monitored the medications, and I think that was a key because we knew what medications were being prescribed, but the medications were not being filled. So to us, that was a red flag, and Delaney did a great job in utilizing that information, particularly with med management appointments, that kind of thing. Delaney, do you want to talk a little bit about it also?
Yeah, I can say that, I gathered that information by attending the one-on-one meetings with the client and the family. Sometimes they were monthly, sometimes I had them biweekly, depending upon how severe the client's needs were at that point. And so then I was able to really empathize with the family to see what was actually going on. Were there financial reasons? Were there transportation reasons? Were there any side effects going on? So I really gathered all that information and presented it to Doris, and then attended the medication management meetings to really advocate for the client. These are the reasons why these actions are not being completed.
So we were able to then also put some supports and resources in place up to quite a long period of time. The family was not really too open to having inpatient supports in the home, and Delaney worked with the family and the client and finally was able to have those services in the home. And we did outpatient, she set up outpatient therapy for them, and HCT. We also utilized our peer support specialist, and we were able to put all those supports and resources within a timely manner because we were able to get the information for Health Infonet in real time. We identified the behaviors and concerns and talked to the family. And Delaney talked a little bit about the being in with med management and really discussing some of those issues that we found related to the prescriptions not being filled. I don't know, do you want to add anything else to that, Delaney?
I would just say that with all of these services and, going through the referral process and getting them set up, I did do a lot of frequent weekly follow-ups with each of the providers just to figure out, is the client participating? Is the client not? What are some of the barriers and what are some of the client's strengths, so that way we can build off of that foundation that we gathered.
And we really celebrated our success because this client, there were no ED visits for 8 months after the supports and resources were put in place. And we're always very cautiously celebrating because, as we all know, all the environmental factors, family factors, and even just teenage development, that can cause issues or crisis again for this client. But at this point in time, we were very pleased with what our outcome was. So we wanted to share that case study with you just briefly so that it was an example of how we utilized HIN in helping one of our clients. Any questions at all?
Well, let's just see if there is any. I'll move that to the question slide. I did want to just mention something that really struck me with both of the presentations today, and that's that with the clients in the behavioral health homes or in your clients outside the behavioral health homes, just in your organization, there's no one cookie cutter solution. You really have to have an individualized approach. And to make that really work, you need that real-time information to act on it. And you made that really clear. The relationships really, I was really struck by the relationship between the two of you, the roles, how the two roles interact with each other, and just the kind of organic, not rigid approach to the work. You really individualize it, and I think that's probably a lot of it. We didn't put that as one of your secret sauce recipes, but I think that's part of it too. I'm not seeing any questions come through. Again, anybody have any questions about what Katie and I presented earlier, as well as any questions for our presenters today, you can let us know. It is looking rather quiet, and I'm not going to keep you on the line, but if something comes up, please put it in chat or send me an email afterwards. I want to remind you that we have our next meeting. It's going to be in January. We will not be having, we're not going to have a meeting the week of the holiday. We decided not to do that. So we will see you in January. Meanwhile, Oh, I did have a question come through. Will next year use a new cohort of patients? No. We're not asking you to upload any new patients. We're going to continue to monitor hospitalization, ED usage on the panel that you have. We're just going to extend our reporting out on those numbers. And I hope that that's clear. Any other questions, come through and let us know. And if you don't, please send an email and we'll get back to you. Reminder that we do want those PAs coming in from you. Any questions, again, please let us know. And I think you all know how to reach me. I want to wish all of you a happy holiday next week. It's Thanksgiving. Have a wonderful holiday. We are so grateful to have all of you working so closely with us. Now go and have a wonderful afternoon, and thank you, everyone.